My thyroid antibodies have come down. I was having irregular periods. It was not stabilizing, and I had a lot of issues with my perimenopause phase. Immediately after all this, as I started this journey, I found that I went into menopause quickly, smoothly, without any issues. And I had a lot of breathlessness issues with breathing difficulty and all those went away. And most important for all, I think, is the weight gain, stubborn weight gain that we all experience.
Hmm.
And that just went down drastically from 72 to 57. Even palpitations, I had unexplained palpitations, anxiety, and mood swings. All those, I became a more calmer person. I felt more focused. I was able to have more energy. Everything was getting better.
Hello, everyone. Welcome back to Reversing Hashimoto's. And today is a very special time because I have a dear client of ours and who is brave enough to share her personal story of how she was able to overcome thyroid and Hashimoto's disorder. So I will like her to be welcomed over here and share what challenges, as a common person shares with thyroid disorders and how you all can overcome those challenges and get back your health and reverse the disease. So, Sitalakshmi, welcome over here.
Thank you. Thank you, doctor.
So can you please
Yeah,
introduce yourself to people?
I'm Sita Lakshmi. I'm from Bangalore, India. And I I've been diagnosed with hypothyroidism in 2008, and that's when my journey with hypothyroidism started. I was clinically diagnosed, but before that, I had a lot of symptoms like tiredness, fatigue, memory issues, all those issues I already had. But I was clinically diagnosed in 2008. I didn't know anything about Hashimoto's until 2022. That was quite a long time. I suffered this Hashimoto's with the autoimmune condition for almost like 15 years. So I just instantly came across your video, one of your videos. I was just searching on the net trying to figure out if I can help myself. I was suffering from a lot of weight issues because of weight issues, joint issues. I mean, all leg pain and a lot of fatigue, no energy to do anything, and a lot of issues. And I needed to help myself. And I also have had a lot of heart issues, also heart palpitations, arrhythmias, and all sorts of kind of issues I had. Breathlessness. I was just going through menopause, perimenopause, and that was a very difficult time for me. And I was kind of struggling to cope with my health. So that's when I was just researching. Maybe my thyroid, there's something to do with my thyroid. So I let me see if I can help myself. So I just was searching on the net about hypothyroidism, and it was by God's grace that I found you on the net. And I just saw your video, and you mentioned about Hashimoto's. There's a condition in hypothyroidism, which is an autoimmune condition called Hashimoto's. So then I went through your video in detail, and I just saw that we need to do the antibodies. And I also saw that you had published a book sometime just recently, just then in 2018 or sometime around that time frame. So I went ahead, I found it on Amazon, I purchased the book immediately, and by the time I ran my lab work, I found that my anti-TPO was very high. It was greater than 1300, and my anti-thyroglobulin also was very high. It was around 70, 67, 70. That's when I realized that I was all along this time I've been suffering from a condition called Hashimoto's. That's an autoimmune condition, and that's how my journey started with you, kind of. And I consulted you, and I took it forward, and I read through your book. Immediately, I received your book. I went through your book. I just implemented the diet changes immediately. That's something that I could do it on my own. So I just started the diet journey. Like I removed all the anti-inflammatory foods, then gluten, casein, soy, corn, sugar, all that I cut out of my diet. And I introduced all the good foods, anti-inflammatory foods like chia seeds, all the seeds, nuts, walnuts, almonds, and all those omega-3 foods. I introduced all that. That was a major change that I did, and immediately within 1 month, even I think it was roughly around the same time that we are having our first consultation. So around that time, I just did the blood work, and I found that my TSH has dropped drastically down to zero point zero 0.01. So I was on Tylenol 125 milligram mcg, and when I just went to the local physician, he said you just drop it down to 88 because the numbers had come down drastically within a month of just the diet changes. Only the diet changes I did, but still my antibodies continue to remain high because probably they were beyond 1300, much higher, and it was not showing in the lab. It was still showing as greater than the 1300. So
Absolutely.
that's
So I
when
want to kind of, just let people know is that a lot of people, when they do their lab work, it shows like greater than 1300 or greater than 1000, and they think that it is 1000 or 1300. And it is not the case. The lab,
yes,
that particular machine can only read up to that number. So the numbers could be 2000, 3000, 5000, 20,000. We didn't even knew how high the numbers are.
yes,
So that's very important to know. And your story is so common that a lot of people, they came to know that they have hypothyroidism, but they never knew the real reason of the hypothyroidism is Hashimoto's disease until they do the blood work. And your disease was diagnosed in 2008, and just imagine 2022 is where you started working. So after even so many years, with a month of changes of your diet, and just few changes, things started getting better. So just imagine if you're diagnosed with 4 or 5 years ago, or just very recently diagnosed,
yes,
what is the
yes,
power that you have to reverse this disease? And the important factor was that even when you were taking the medicine, as far as I remember, you were having a lot of symptoms even with the medicine. Is that correct?
yes, definitely, definitely. It was not helping me in any way. And my dosage was increasing. I started with 25 mcg, went on increasing to 125. At one point, it was even 200 mcg on weekends. I had to have 200 mcg on weekends. And
Wow.
that was the path that it was taking. It was going higher and higher. And that kind of made me very scared. It's going high. Every year, it's increasing. So that was also kind of, but I didn't have any clue as to what was going wrong because I met a lot of physicians here, but nobody told me that you have a Hashimoto's condition.
And that is
So
again
there
so
was
common.
nobody.
Like people always get started. Oh well, it's such a small dose of medicine. Does it's not
Yeah,
bothering me, and then slowly and slowly this keeps on increasing, but the symptoms do not get better. And until people
yes,
reach this, 100 or even like sometimes 200, which is a scary high dose, because it
yeah,
shuts down your thyroid, doesn't let it produce its own thyroid hormone, and the underlying inflammation, underlying autoimmunity is destroying your thyroid. So most people unfortunately get into this whole struggle with medicine keep on increasing. They do not feel better, and then suddenly they realize they don't have anything else to do. So I'm glad that you were open and you were kind of looking for answers, and you were okay with making changes and at least taking this path of healing your thyroid.
I'm so glad I found you on the net, and it's a wonderful book that you have written. And I think it details every step of how to go about your diet. Even I think you've touched upon supplements too, regarding ashwagandha and all those supplements too. You have touched upon not everything, but at least some of them you've touched upon. So I think anybody can start the journey with the book initially, at least a diet and little bit of supplementation, and then they can take it forward with you furthermore, and understanding each body is very different. So in my case, I was suffering from low iron, so you helped me with those issues and all that.
Absolutely. It's a personalized journey. I always tell people. And the
Yes,
reason of
yes,
writing the book was also the same, that, not everybody needs me or any other physician. You can take your own health into your own hands. At least starts with the basics, like how you did, right? Making changes to your diet, making changes to your lifestyle, sleeping better, like stress management, whole bunch of things that you can do on your own. You don't have to rely on a physician. And I want to write a book where it was in a language where people can understand and also implement it like actionable steps. So absolutely, you're correct that the book has all these things like written down. Even now, since the book, we are publishing so many videos which also we
yeah,
detail a lot
that's
of
very
different
informative.
steps.
Yeah, all your videos are very informative, and I've been following you on, and that's when I got even more scared when one of your video, I mean, I think it was a live Q&A session. That's when I got to know that one autoimmune can lead to the other.
Absolutely,
That
yes.
kind of really scared me, and I felt that I need to do something about it right away. I need to be consistent with what I'm doing and I need to see the results. So that kind of motivated me to work on it more rigorously.
Absolutely. So tell us about, like, you made some changes to the diet. Then how was your journey after that? Like, what changes, you made further that was required for you to get better, and what kind of results did you see?
Yeah, I smoothly went into menopause. I didn't have any issues. I was having irregular periods. It was not stabilizing, and I had a lot of issues with my perimenopause phase. And immediately after all this, as I started this journey, I found that I went into menopause quickly, smoothly, without any issues. That was one big thing. And I had a lot of breathlessness issues with breathing difficulty and all those. All those went away. Like once I fixed my diet and iron, yeah, I think you gave me iron supplements also to improve my iron now, my ferritin levels. So all those breathlessness issues and most important for all, I think, is the weight gain, stubborn weight gain that we all experience.
Hmm.
And that just went down drastically from 72 to 57. So it just
Wow.
went down so well. It dropped down. So it was good. And even palpitations, I had unexplained palpitations, anxiety, and mood swings. All those, I became a more calmer person. I felt more focused. I was able to have more energy. Everything was getting better. That's what improved. Though I'm still on levothyroxine, I'm still on the medicine, but I hope to kind of reduce it down the line.
Absolutely. And again, like always tell people, it's not about the medicine, like, okay, well, if you are just focused on get, like, if I am going to able to get off of the medicine, then only I'm going to work on my health, then that's not the right outlook, right? Because you're doing it to improve your overall health, you're doing it for prevention of further diseases and also improving the quality of life, right? Because you said that there were so many different symptoms. Unfortunately, people have been told about these symptoms, they are not going to get better. So after years, they feel that this is their normal life, they are going to live this way. But like, that in within a few months, like, of changing these things, you can get your life back, things can get better, symptoms can get better. You're able to reduce a dose of medicine. Yes, you're still on medicine, unfortunately, because the
Yeah,
disease
yes,
process has been
I'm on
going on for
medicine,
such
but
a
I'm
long
so
time.
glad that my thyroid antibodies have come down. So I'm no longer under that path, trajectory of an autoimmune disease where I can end up with another autoimmune disease. So I have
Absolutely.
fixed the root causes of my autoimmune disease. At least I'm glad that I fixed the root causes of the autoimmune disease.
Absolutely.
So
And I think
that's
initially also your antibodies were not budging, and you and me both were like little bit
yes, yes,
concerned
yes,
because
yes.
they're still
But all
stable.
that was required was consistency in what the diet and the lifestyle and whatever the approach we are doing, the functional medicine approach, that has to be followed consistently. It takes months, at least for me, it has taken 2 years for my antibodies to come down.
Hmm.
So it was just that you have to persevere and have that consistency and do it. So that's definitely light at the end of the journey, at the end of the tunnel. Yeah.
And if you don't mind sharing, like, what was your recent antibody, so that people can know that
Yeah.
from more than 1300, we
Yeah.
didn't even knew how high they were to from
Yeah.
where they've come now.
So I just ran my tests in September, and anti-TPO has come down to 81.43, and my anti-thyroglobulin has come down to 2.39, and my homocysteine has come down from 15.4 to 6.56, and my HSCRP is also from 0.12 to 0.07, and my HbA1c is also down. I was pre-diabetic 5.8% to 5.3%. I'm
Well,
no longer diabetic.
that's great. So you
Yeah,
were able to not only reverse one disease, but multiple
but
diseases. You had a lot of
yes, yes,
inflammation, which came down.
yeah,
You were a pre-diabetic, you became normal with that. And plus, from greater than 1300, the antibodies are down to, like, in 80s range. And the
81.
other one is practically normal, the thyroglobulin.
Yeah,
That is
yeah.
amazing. That is amazing. So that
Yeah.
was really good work. So what do you think? Like, what message you have for people out here?
Have hope. There is hope. Definitely, there's hope, and you can work with a functional medicine doctor like you and take the journey, healing journey forward. All you from their part, what they need to do is to be a little more perseverance. You need a little more perseverance and do it consistently. and it doesn't happen overnight. It takes months, and depending on each person's body, it may take even a year or two. In my case, it has taken 2 years. So if you persevere, you can also find success in your healing journey.
And this is so important because when people start working, with me, or there are obviously great functional medicine providers. I don't want to just kind of limit this to me. I just want to tell people is that, it's a long-term journey. If you're looking for a quick fix, like, okay, well, I want these antibodies down in, like, day one or like in 1 month, it doesn't happen, right? And as you said, we have had people within 4 to 6 months, their antibodies will come down beautifully down. And there are some other people like you, it just like, takes a little bit longer. And I always tell people, like, don't worry, just have trust. This is the process which have been time and again tested. This is not just with one person or 2%, thousands of people, who have tried this process of functional medicine and were able to reverse the disease. You just have to have trust, not only the process but yourself. And I think that's what you had trust in yourself that you can do it, and you were motivated, and you continued the things in your lifestyle as well as supplements even after that, right?
Yeah, you need to be consistent and continue with the belief. You need to have belief in yourself and in the process.
That is so important. And once you do that, then obviously beautiful results happen, right? You can see the improvement in the numbers. And first of all, like always tell people is that you need to get your life back, right? You
Yes.
cannot
Symptoms.
revolve your life around this disease. The disease should revolve around your life. So that's what we want, getting the life back, improving the quality of life, and also preventing any other diseases. And the beauty about this is that, as you said, like always tell people, we are not just working on thyroid, we are working on your whole body approach. So you want to
Exactly.
reverse not one disease, you want to improve your heart health, you want to improve your diabetic health, you want to improve your weight, we want to improve, your mental
That
clarity, your gut health, and also the thyroid. And I think you saw improvement in all of those things.
all the areas I found, it's a holistic treatment. I would say it was holistic. It was addressing all the issues instead of me going running to the doctor and saying I'm having palpitations. A cardiologist runs me through the echo ECG and says everything is fine. I just come back again and I'm back to square one. What do I do about it? So and I have migraine issues, headaches. I had all those issues, and I just go to a physician. They don't find anything wrong with the lab work, the general lab work. So again, I'm back to square one. What do I do? So the underlying root cause is that I was suffering from an autoimmune condition, and that involved it's a holistic approach where your gut, your overall all the issues have to be addressed. Where I was pre-diabetic, and all those issues had to be addressed. I was ferritin levels were low. All those also had to be everything were addressed. So
Absolutely. It's a
as
stepwise process, right? Like again, people said, well, I'm doing lifestyle changes, I'm taking supplements. What different is going to do? Well, unfortunately, yes, you're doing great job, but you have not addressed all of the things. And suddenly, slowly and slowly, step by step, if you address all of those things, that's where magic happens, right?
very true.
Great, great. Well, thank you so much for sharing your story, and motivating other people and giving them hope. Because my whole goal, since I found this functional medicine, is to give hope to people that they can get better. Don't let anybody tell you that you cannot get better, you cannot get your life back. If you do the right things, if you be consistent, things are going to change.
Definitely, definitely. I'm so glad that at least few doctors like you are taking the functional medicine approach to the public. Not many are still aware of functional medicine, at least in India. Just you can handpick them, just one or two. So it's still not picking up in India, the functional medicine approach. So I'm so glad that I found you and I could take myself through this journey, and I've healed myself of the autoimmune condition.
Absolutely.
Thank
Yes.
you.
The momentum is going on. So don't worry. It's all over the
Yeah,
world. Like in when I started functional medicine in US 10 years ago, again, very few people knew about it and very few practitioners were there who were doing a good job. And then obviously people came to know about it. They started getting better. And suddenly, like more and more practitioner got trained into it. So in United States, it is already a very big movement. And I think other countries are also catching up, and hopefully in India. That's what my personal also goal is there. that I want to see people in India having access to functional medicine. So I'm doing kind of a lot of work with the local societies of functional medicine in India and promoting it, and also sharing the knowledge that we have so that people can at least start with the basics and do things.
Yeah, that's good. Good to hear, and God bless you to do more for our people in India also, because I'm sure they don't have access. People in India don't have access to all this information and this process, this whole functional medicine approach. So this kind of this journey, how to go about this journey. There's no guidance available in India. So your book is a
Absolutely.
good starting point, but from there on, you need some more support. So that's where your guidance is very much needed.
Right. That's the reason we opened this telemedicine, functional medicine practice. Started with seeing, like patients only in United States with US, but now we are seeing patients like all over the world. So that is a good part about technology that now we can reach sitting in like, just one particular part of the world. We can just access the whole world. So absolutely. Well, thank you. Thank you so much again for coming over here and sharing your story and giving hope to people. Best of luck to you. And
Thank you. It's my pleasure
absolutely.
to share my journey with others and to give them hope and motivate them. And I wish them all success in their healing journey.
Absolutely. Absolutely. All right, guys. Thank you so much. Hopefully, you got some hope. Hopefully, you got some insights that, yes, you can get better. Please share your comments. If you have any questions, email us and just keep, as she said, just keep doing the basic things from reading the book and watching the videos. So we'll see you next time. Bye bye.